Just want to start off by saying hi, everyone. My name is Deanna. I am excited to share some information on emergency preparedness in the new. Throughout the webinar, we will be doing a live poll with questions, so you can go ahead and grab your cell phone along with another handheld device if you'd like, so you can participate. So let's go ahead and get started. Just a quick introduction about myself. I am a dental assistant, a graduate from George Brown College, as well as a Humber College grad where I studied Emergency Telecommunications as a secondary career in transferring knowledge. These programs combined, along with almost 10 years of experience in the field, have taught me how to respond to medical emergencies in a dental clinic. Working for HandsomEd, a pharmaceutical and medical device company, I felt it was best to continue working for a dental practice to keep up my skills as both professions go hand in hand. Let's jump into today's agenda. I want to take a different approach on the pandemic. Guidelines are constantly changing and majority of clinicians' focus have moved to infection control for the most part. Today's focus is about a matter that we cannot underestimate, postpone, or forget about. Medical emergencies can and do happen and are more likely to happen due to stress of COVID. The goal of today is to get you prepared to save a life while staying safe. So if you have any questions throughout the webinar, there will be a time at the end for questions and answers. I wanted to make this webinar somewhat interactive and hands-on since we're doing it live. So if you can, please grab your cellular device or a tablet and go to pollev.com. Once you get to pollev.com, you're going to type in the name HandsomEd right where it says username. And then you will join. The screen will then prompt you to add your name, and you're welcome to add your name or your email address, anything you'd like. And then when you hit continue, we'll be ready to go. But we're just gonna give it another 10, 15 seconds so that everybody can join on. Throughout the webinar, poll questions will be asked and you can answer through your device. I changed the questions from my end. So once you submit your answer, the question is done, but the screen may not change. At least it won't change until the next question, which will be prompted by me. Okay, so let's test it out with our first poll question. And the answers are anonymous. Your name will not be shared with anyone but HandsomEd. So if you were able to log on to pollev, go ahead and answer the poll question. Okay, so we're gonna move forward. So some patients, when they come to the dentist, they're already very nervous. And thanks to COVID, patients are potentially at a higher risk of a medical emergency. Medical emergencies don't happen often, but when they do, as dental professionals, we are legally obligated to help until the EMS team arrives. Due to the fact that emergencies do not happen often, it was recommended by the RCDSO to conduct mock emergencies. What's your protocol when an emergency arises? And is everybody on board, including the front desk staff? With all the stress on patients and sometimes even on the dental team, we need to be aware that we are surrounded by a higher risk of medical emergencies than ever before. This chart dictates some of the most common medical emergencies according to Dr. Stanley Malamed, where he states that stress is the #1 cause of a medical emergency in the dental office. But prevention is key. Almost all medical emergencies can be prevented by conducting a proper health history and physical evaluation. While health history forms are very important, a physical evaluation is just as important. A lot of times it starts with the receptionist or the dental assistant prior to seating a patient. At the physical evaluation, we are able to tell if something is physically wrong with our patients just by looking at them. And yes, there are a new set of COVID questions to ask, but this does not in any way replace any other health updates. All evaluations must be conducted prior to treatment. So let's do another poll. I check my patient's blood pressure every single appointment before starting treatment. Okay. Remember, prevention is key, but that does not mean that they are impossible to transpire. Another Malamed classic is his idea of an action plan. This action plan will help put the roles of each team member into perspective. Now, each clinic is different with different quantity of staff and different locations. So for the sake of this webinar, this action plan should just be taken as a guide. An action plan consists of preferably 3 team members. Member number 1 is the person who recognizes the medical emergency. Member number 1 does not leave the scene of the emergency, but activates the in-office emergency response team by using keywords like help. Member number 2 is the next closest person to the emergency. Person number 2 is in charge of gathering all PPE, gathering the emergency kit, the oxygen tank, and the defib. Person number 2 is also in charge of preparing the medications for the doctor to administer. This person will also invite a 3rd member to come in and help. Member number 3 is in charge of calling 911. This person is responsible for knowing the location and phone number to the clinic. This job is very important and may be best suited for somebody that makes daily calls and gives clinic information. Maybe the receptionist would be the best person for this member. This person may also be the one to flag down emergency responders upon arrival. If your clinic is located on the 5th floor, for example, of a building, a 4th person may need to be involved to keep the elevator doors open. This plan is important to follow so that steps don't get missed. Everybody has a job and everybody needs to know each member's role within the action plan. It's not to say that person number 1 will always be the dentist or person number 3 may not always be the receptionist. So it's very important to get familiar with all 3 of these roles so that you can overlap if you ever need to. Okay, moving on to encouraging our patients to seek medical help. This is Dr. Abdu Sharkaway. He is the infection disease specialist with Toronto's University Health Network. He is the specialist who is recommending that we encourage patients to seek help if they are not well. At this point of the COVID stage, we understand the importance of masks and hand hygiene and social distancing to prevent the transfer of the virus. But by following these protocols, patients should feel safe to use our healthcare system. It may take some encouragement, but it's better off than having something happen in the clinic. Let's think of the consequences of a delayed reaction to a medical emergency. If a patient feels discomfort or is in distress but ignores those symptoms because they're afraid of going to the hospital, the treatment may be too late. For example, go on to the slide here. A 65-year-old male patient, generally a healthy patient coming in for a chipped tooth 3/6 OB. We have an updated medical history form completed and signed off by the dentist. There was a COVID screening completed upon arrival by the dental assistant. The patient screened negative, but who's to say that this patient is just not asymptomatic? Temperature was on the high side, but still within normal limits. Treatment completed as planned without anesthetic, without any complications. Upon leaving, the patient developed shortness of breath and required oxygen. The team needed to act fast, so there was no PPE being worn at the time. After 5 minutes of straight oxygen, the patient's mask was removed. Symptoms subside, but when the patient stood up, he collapsed and he was gasping for air again. This time the ambulance was called. We found out later on that the gasping and the collapsing was due to fluid buildup around his heart. So let's take a quick look at what some symptoms of COVID-19 are. The one that I really want you to focus on right now is the shortness of breath and the difficulty breathing. The patient showed no signs of coughing or headaches, nor did he actually have a fever. Needless to say, the dentist and the assistant that responded to this emergency were asked to go home and quarantine until they knew for sure that what the purpose of the emergency was. For safety measures, all patients for the next 48 hours were canceled and the clinic was shut down. Based on the information that I'm telling you here, do you think that this could have potentially been COVID? Could it have been congestive heart failure? Or do you think it could have been another underlying condition? Just give another couple seconds for some answers to come in. Just for fun, let's see what everybody's response was. Okay, so we have a bit of a debate here. This specific case, the patient actually had congestive heart failure. We wouldn't have known about this unless proper pre-assessments were taken, such as their blood pressure or the SpO2, which is the pulse oximeter, the amount of oxygen that their blood is carrying. This could have potentially been avoided, but the patient did not feel safe going to a medical professional. The patient later admitted that this wasn't his first episode. The clinic reopened the next day and quarantine was not necessary. So just to reiterate the importance of encouraging patients to seek medical attention. So do I need to take any enhanced precaution? The short answer is yes. It is important to follow enhanced precaution when dealing with medical emergencies. We can reduce exposure by wearing PPE and limiting people in the clinic. This means less accompanying persons unless it's a child or somebody who needs medical assistance. Ensure that masks are always worn unless being treated, including when staff is communicating with other staff members. Chest compressions are not considered an aerosol generating medical procedure, so they are able to be started right away if necessary. But when it comes to ventilations, mouth to mouth, an N95, eye protection, and all other PPE must be worn. A quick tip, have a respirator and eye protection and other PPE as part of your emergency setup. With the primary focus on infection control, there could be less time to focus on emergency preparedness. Having the right medications, a kit, tracking, monitoring, and replenishing your emergency medications are all very important. If a clinic goes without and an emergency occurs, the clinic could be in a lot of trouble, both legally and morally. That being said, let's talk about some kit options. Here are the most common options. On this side here, we have your typical safe. It sounds like a good idea to lock up the medications. This way, nobody can get into them. But when the emergency happens, you'll find yourself asking, where's the key? Who has the key? In a medical emergency, seconds truly matter. Then you have your typical tackle box. Your tackle box is where all your medications are located, but it's very unorganized and they're all just kind of thrown in, along with Band-Aids and Advils and all other non-medical emergency related items. It's important to remember that an emergency kit is different than a first aid kit. According to the Canadian Dental Association, medical emergency kits are required. First aid kits are strongly recommended. So there's a difference there. You also have the baggie system. The baggie system is a fan favorite, but I'll explain more about it in just a second. And of course, you have your proprietary medical emergency kit. And that's the proprietary medical emergency kit is a nice one to have because there's a home for each medication and each medication is in its home. So it's very organized. The two I want to focus on and the two most common kits to have are either the baggie system or the lighthouse kit. The baggie system is sometimes given out at medical emergency courses. The pros to the baggie system is that it's easy to set up and it's easy for staff to assist. The baggie system consists of about 3 or 4 little baggies, each with instructions along with medications pertaining to the type of emergency that's happening. For example, the allergy bag holds the allergy medication, and the heart attack bag holds the heart attack medication. The downfall to this is if an emergency overlaps, you're having to dig into a different baggie to find the right medication and the instructions. For example, let's say that a patient is experiencing a bronchospasm. That's an asthma attack. That type of emergency calls for an inhaler. Now let's say that we've administered 2 puffs to the patient, and for some reason, they're still unable to breathe and they're still wheezing. At this point, the patient could be potentially experiencing an anaphylactic reaction. It will then take a different baggie to overcome this medical emergency. And let's not forget what we said in the last slide, seconds really matter. There's only one proprietary kit on the market, and it's called Lighthouse. It's convenient, it's user-friendly, and you will always be prepared to save a life. What's nice about it is that the medications are all laid out in the event of a medical emergency overlap. There's instructions in front of you, there's a guide right inside the kit, and both medical emergency kits will work. It just depends on the preference of the clinic. It depends on what the doctor prefers to have and to use. The important thing is to have the right medications. So let's go into our next poll question. Who tracks and monitors and replenishes your clinic's medical emergency kit? Maybe we should hide these answers for now. Okay, let's see what the most common is. Yeah, office manager, very common, dental assistant, or it's a combo with everybody. Okay, let's go on here. How can HansaMed contribute? We also rely on the RCDSO and the CDHO, and the Lighthouse Emergency Kit is compliant. A medical emergency can happen, and with our new regulations on PPE, treating patients differently, we want to ensure that emergency preparedness does not fall through the cracks. HansaMed takes on the responsibility of tracking kits and expiration dates, replenishing only what is needed for an affordable cost. While there are many medical emergency kits on the market, consider things like time, resources, risks of going into the pharmacy at this point, and also price. For more details about this, please leave your email in the Q&A and we'll be happy to pass on more details about Lighthouse later on. But we just wanted to share a little bit of information. What needs to be in a medical emergency kit? So now I want to briefly go over what's actually held in a medical emergency kit that makes it so effective. Epinephrine. Adrenaline is the most important drug in emergency medicine. It is the drug of choice in the management of the acute life-threatening multi-system allergic reaction called anaphylaxis, as well as providing a degree of vasoconstriction that can be helpful in the presence of edema, which is swelling. Although EpiPens, the brand, is not required, they are quick, they are safe, and they are very easy to administer in the event of an anaphylactic reaction. Dr. Malamed strongly recommends having an EpiPen. I want to show you a quick video of why Dr. Malamed believes that EpiPens are good to have in your emergency kit.
About a year and a half ago, an article appeared in the ADA News suggesting that a dentist does not need to have an epinephrine autoinjector, that buying an ampule or a vial of epinephrine is much less expensive and as useful. And that is untrue, because the autoinjector is designed for simplicity. You simply take the caps off it, you hold it against your leg, and you've now given yourself administered the appropriate dose of epinephrine either to you or the victim of anaphylaxis. Most dentists have never opened up an ampule of a drug. They don't have the experience. They are not comfortable using plastic disposable syringes. These are non-dental devices. And in a crisis situation like anaphylaxis, where a loved one or a patient is literally dying in front of your eyes, it'll be very, very difficult to do this for the first time. And the other thing is that the ampule, the vial of epinephrine, contains 3 doses that crisis situation, when you're probably not thinking clearly, it would be very easy to over-administer that very, very important and potentially dangerous drug. So I strongly recommend that we use the epinephrine autoinjectors as opposed to the ampule vial.
So let's go on here. If you don't have an EpiPen, but you have epinephrine vials, you're still compliant. Although people are more inclined to use EpiPens, the vials are a good idea to use in the event of a biphasic allergic reaction. A biphasic reaction is when the anaphylactic reaction comes back for a second time. EpiPens are a one-time use, so if they've been used, epinephrine vials are a really great backup option. You should also have diphenhydramine in your medical emergency kit. Diphenhydramine essentially is Benadryl, and it's used in an allergic reaction to prevent that biphasic reaction. If a patient is given diphenhydramine, they should not drive home. As we all know what Benadryl does to us, it makes us drowsy. So again, this medication is only used to prevent a biphasic reaction. It's not used to treat anaphylaxis. Your medical emergency kit should also contain nitroglycerin. This medication is used to treat angina. Through experience, Hensomet supports the use of a pump spray over the tablets due to expiration dates. The pump spray will always have a longer shelf life over the tablets. Once the bottle of tablets is open and they have been exposed to the oxygen, they have about a 3-month expiration date. So if you're thinking something you want more long-term, the nitroglycerin pump spray, you're going to get a longer shelf life. Let's do another quick poll. True or false? When a patient experiences a heart attack, it's a blood circulation issue. When someone experiences sudden cardiac arrest, it's an electrical issue within their system. Let's see what everyone says. Okay. All right, so again, we have a little bit of a debate here. Hey, you can't change your answers. Okay, let's go on. I want to talk a little bit about aspirin because aspirin is a key medication when a patient is suspected of having a heart attack. The requirement is for a patient to take from 160 milligrams to 325 milligrams. But the key is the non-enteric coated aspirin. That means that there's no candy coating on the outside. So when a patient is experiencing a heart attack, the aspirin is placed under their tongue to be dissolved, not to be taken with a glass of water. If a patient is suspected of having a heart attack, they should never have a glass of water and an aspirin. It should always just go in their mouth and allow it to be dissolved underneath the tongue. When a patient is having a heart attack, it is a circulation problem. It means that their heart is not pumping strong enough for blood to flow properly to our brain. And if we have no blood or oxygen flowing to our brain, what typically happens? Okay, you guys can't talk, but usually the patient will die. So here's where we're going to talk about the difference in sudden cardiac arrest and a heart attack. It's important to understand the difference between the two because these terms are often overlapped, but they have two completely different meanings. If you misdiagnose it, it can be life-threatening if the wrong one is chosen. One is a circulation problem and one is an electrical problem. When the patient is experiencing sudden cardiac arrest, aspirin is not needed because the patient is unconscious. If somebody has sudden cardiac arrest, they have collapsed and they are not breathing. And if they are not treated with a defibrillator within 4 to 6 minutes, the patient can die. A patient experiencing a heart attack does not require a defib. When the patient's having a heart attack, more often than not, there are warning signs from the patient, and typically death does not occur. Let's talk a little bit about atropine. It's an important medication to have in your emergency kit as well. It's to treat patients with an existing condition called bradycardia. And bradycardia is what happens when your heart beats extremely, extremely slow. Atropine is not on the list of required medications according to the RCDSO, but Dr. Malamed recommends having atropine in the emergency kit because it's one of the 3 main medications that are pertaining to the patient's heart. I see we have a question that came through, so I'm going to go through and I'm going to answer the questions at the very end. Okay, blood pressure and pulse oximeter. We all know what BP does and what it is, and we need to go over a couple of few quick tips. Make sure when you're checking your patient for blood pressure that you have your patient sit quietly during and before the monitoring. Make sure that their arm is positioned properly as it's shown in the image down here. And place the cuff on bare skin, not over clothing. However, it's not a good idea to roll up the sleeve because what's happening is you're cutting off the circulation. You're putting stress on the vein. So you're not gonna get an accurate reading. It's best to have the patient slip their arm out if possible. And if you're not happy with that reading, take a second reading. When it comes to, okay, so what's nice is that some blood pressure monitors have a built-in SpO2. It's hardwired in. Nonetheless, both need to be checked prior to treatment. These 2 tests especially will help prevent the most common medical emergency known to dentistry, which we talked about is syncope. So now we're going to talk a bit about cardiac arrest. In Canada alone, 35,000 to 45,000 people a year will die of sudden cardiac arrest. AEDs are not required across the country unless sedation is being performed. Depending on the level of sedation, defibs can be required. But why risk sudden cardiac arrest if the clinic you work for doesn't perform sedation? A fact about sudden cardiac arrest: it can happen to anyone at any time. It doesn't matter the age or the weight or the gender or the race. As an AED, it's a life-saving investment. When considering an AED, you want to think about a few key points. The first one, is it easy to use? Most AEDs on the market these days will talk to you. They will guide you through the medical emergency. Most will even count out your CPR repetitions. Another key point is asking if the unit is automatic versus being semi-automatic. The difference is in the shock delivery. As dental professionals, we are not trained excessively in this area, so to err on the side of safety, a semi-automatic unit will tell us if and when a shock is to be delivered, while an automatic unit will just deliver the shock without a warning. An automatic unit is best used for paramedics or doctors or people more professionally trained in this field. That being said, with a semi-automatic unit, it does take a second to determine the heart rhythm, so you should look for a device with a quick initial and secondary shock to help your patients as quickly as possible. Salbutamol is one of the most common medications for people to use. It's used to treat patients experiencing asthma. Everybody has asthma. Asthma is triggered by stress. So we should always be prepared with the one in our emergency kit versus the one that the patient has. The one that the patient has, unless they've taken it out ahead of time, could potentially be expired, it could be broken, or there could be other issues with the salbutamol. The one that's held in your emergency kit, the one that you are tracking, monitoring, and replenishing, or we are doing it for you, we can always be sure that it is ready to be used. Let's do another quick poll. When a patient faints, our first go-to besides oxygen should be what? Let's see what people are saying. Yeah, okay, so we're going to talk a little bit about why orange juice or soda may not be the best idea, but the right answer right now is it's to glucose. But before we start talking about that, let's talk a little bit about ammonia inhalants. These are simply smelling salts, and they're used to treat patients who have fainted or who are feeling faint. Smelling salts can be dangerous if they are not used properly, And there are many controversies about ammonia inhalants. Some doctors prefer them. Some doctors say that they're very bad for you. If a patient does not wake up with the smell of ammonia inhalants, the emergency responders better be on their way because the emergency will be much bigger than what we can handle. It's a very potent smell. If there's anybody on the call who's ever bleached their hair or has any light hair colors, you'll be able to smell it just by talking about it. It's a very, very potent smell. Glucose is simply sugar. We talked about this in the poll. Instaglucose is used to treat patients who are hypoglycemic. Instaglucose should always be the first drug of choice over a chocolate bar or a soft drink. The reason we say this is for the unconscious patient. If the patient goes unconscious, chocolates and drinks, they will not be properly taken. And Instaglucose, it just goes underneath the patient's tongue or it goes on the inside of the patient's cheek. There's no chewing or swallowing necessary, and therefore it is safe to use on an unconscious patient. We can't assume that everybody who experiences hypoglycemia will be conscious and will be awake to eat a cookie or to have a chocolate bar or drink a juice. We want to assume always worst case scenario. So if you have Instaglucose handy, whether the patient is alert or not, you are able to use it. Okay, oxygen therapy. More often than not, when a patient starts to feel unwell, the doctor's first go-to is oxygen. Oxygen is used in about 90% of all medical emergencies. So it's very important for all staff members to know where the oxygen is located and how to turn it on and how to set it up and how to administer the oxygen. The liters per minute will always be prescribed by the doctor. However, staff are always encouraged to know how to manipulate the tank. For those of you on the call, HansaMed is trained on setting up oxygen tanks. So if you do have one, we are happy to walk you through it and how to use it. So again, you can drop your details or your information in the Q&A and we can cover that at the very end. Okay, Naloxone. Naloxone is an opiate overdose medication, and it's used in clinics where conscious sedation is performed. So it's not used in every single dental clinic. Many of you may have heard of Naloxone in this day and age due to the amount of opioid street drug usage. It's the same drug that they're using, but this is a reversal agent, and it's used typically in a clinic where we may have accidentally overdosed our patient. You can tell that they've become overdosed because they become drowsy and their pupils get very, very, very small. So a trained doctor who in sedation will be able to look out for these symptoms and will be able to treat them accordingly. The next one is Flumazinil. It's also a reversal agent, but it's a benzodiazepine overdose medication. This drug is also used in clinics where conscious sedation is performed. Benzos are used quite often, sometimes more often than opioids are used in a dental clinic. Benzos make you drowsy and they give you lack of coordination. So in the event that this happens to any of our patients, Flumazinil will just reverse that feeling. So in summary for what we talked about throughout the webinar today, the best way to be prepared is to conduct an emergency response plan, then complete mock tests at every staff meeting, if possible, or at least once a month. We learned to prevent, if possible, by checking blood pressure and SpO2 on every single patient, and make sure you record those findings. This is key for an incident report. If something does happen during or before or after the treatment, it's good to let the emergency responders know what they came in at and what their baseline is. It's also a good idea to record any medications you've administered, so you can also give those to the emergency responders so they know how much medication they can give so we don't overdose our patient. We are all in COVID together, so consider allowing someone else to handle your emergency kits for you so you have more time for infection control and for patient focus. Thank you, everyone. This webinar will be posted to our YouTube channel sometime next week. So I'm going to stop sharing my screen now. And I think we have a couple of questions here. Let's see. Okay, what if someone is unconscious? Do we still put aspirin under the tongue? The answer is yes. If a patient is unconscious, you would still put the medication underneath the patient's tongue because it's going to be absorbed. They don't have to chew and they don't have to swallow anything. The next medication here, what if medications are expired? Can you still use if 1 month expired? We will never advise you to use expired medications. We will never advise you to use expired medications. If your medications are expired, bring them into the pharmacy and change them in. If your medications are expired and you're finding that this is a constant thing that's happening, you want to make sure that maybe somebody else can take care of the medications for you. If you're unhappy with the service of individual tracking of the medications and being billed each time a medication comes out, we do have something called the annual subscription. The annual subscription is when you pay once a year, and anything that expires within that year, we will replace for you at no charge. So does anybody else have any questions? Anything that they might want to add? At the bottom of the screen, you'll see there's a little section for Q&A, and there's also a little section for chat. So if you have any questions, we're open to them. So I'm just getting a side question here, just what the difference is of automatic replenishment. So when you are on the Lighthouse team and you have one of our emergency kits and we take care of the medications for you, what we do is when you purchase a kit from us, we individually monitor the expiration dates and we ship you a new drug prior to your old one expiring. What's nice about the emergency kit is when you purchase a kit for the first time or when you're on subscription, you get an online training webinar, which is fantastic for maybe those who couldn't make it today. And if you want greater details about the medications, the online training webinar is about 1.5 hours long. You get 2 CE credits from it, and you get unlimited access for the entire year. Thank you so much for everybody who was able to come into the webinar today. And I hope everybody has a great day, great weekend ahead. Thanks, everyone. Bye.